This is our emergency situations PowerPoint. This is our different things that can occur to our patients, severe weather, different things of that nature, emergencies that can happen that we need to know how to properly react to. Now, it is important to note that wherever you work, they will have specific procedures, guidelines, steps to take anytime any emergency happens, especially when it comes to things like fire, severe weather, and things of that nature. So make sure you always follow your facility procedures and policies. However, these are some general guidelines we're going to go over when these things do occur. All right, so what different emergency situations can come up or arise while we're working with patients? One, our patients can choke. They can go into cardiac arrest. They can have seizures, loss of consciousness, burns, external hemorrhage, meaning that they could start bleeding. Fire could occur. The power could go out. There could be severe weather like thunderstorms, high winds, tornadoes. They could go into shock, all right? So these are the main emergency situations that we're going to touch base in this class about. There's other things that can happen, and once again, each facility may have their own policies on this, and I will touch base on a few other ones that people do have policies. A lot of hospitals, just quickly, do have policies on if they have a labor and delivery unit and there are babies, they will have some type of policy on if a baby goes missing, on exactly what needs to take place to make sure that the baby does not leave the hospital. If there's ever some type of violence or weapon or anything of that nature, there will be a policy on how to handle, how to page security or police if they're in the building, and make sure that it's handled as safely as possible as well. So just make sure you understand that those other ones exist as well. But once again, it depends on where you work, and they should go over the exact steps and standards when it comes to that. So the first thing we're going to go over is the choking issue. If one of our patients starts choking, a coworker, anybody starts choking, what we need to do is what we call the Heimlich maneuver. But first of all, we have to know, how do we know if they're choking? All right. If the person cannot speak, they cannot cough, and they cannot breathe, there is nothing coming in, there's nothing going in or out, all right, of their airway, then they are choking. If the person can speak, if they're coughing, they're breathing, allow their body to try to get that item that they're trying to cough up out, okay? At that point, their body's still able to do that. If they cannot speak, cough, breathe, or call for help, then this is when we need to jump in and complete the Heimlich maneuver. So the first thing we're going to talk about is for adults and children. For adults and children, what you're going to do is you're going to stand behind the resident or the patient, all right, whoever's choking, you're standing behind them. You're going to wrap one arm around the patient's waist and make a fist. This fist is going to be placed about 2 inches above the belly button, all right? The following arm is going to be wrap around the patient, and it's going to wrap around the fist. And what you're going to do is you're going to put that against the abdomen 2 inches above the belly button, and you are going to grasp the fist with your other hand that's wrapped around the patient. And I'm going to continue this onto the other slide here. And what we're going to do next is when we have our hands placed like that, we are then going to go in and out, all right? So we want to, in and up, not in and out, in and up, all right? So we are sort of giving them almost like a big bear hug from behind, but with our fist, what we're going to do is drive that into the person's abdomen and up at the same time. And what that does is that forces all the air in the lungs up into the airway, hopefully with enough pressure to allow that item to come out. You are going to continue these thrusts until either the item is expelled, comes out of the mouth, out of the airway, and they're able to breathe again, or until they pass out. Hopefully, it's the first, right? Hopefully, we're able to do these thrusts. You're going to continue doing them as hard as you can. until that item comes out. Once again, if that doesn't happen and they become unconscious, then you would start CPR if you are trained in doing that, and that's your facility policy, okay? Once again, you'll need CPR training, and that goes into the details of exactly how to perform that. So there's a lot of different reasons why somebody might go into respiratory distress. They might choke. A lot of the things you're going to see here are diseases, improper feeding technique. If they're not supervised while eating, and they need to be supervised because maybe they have issues putting, they might not be able to chew their food down to small enough bites, and it needs to be cut up. If they're in an improper position, all of these things can cause somebody to start choking. You see a lot of little kids who tend to put everything in their mouth and they can choke on small objects. So it's just important that people are supervised while they're eating. They're in a proper position. They're using good techniques. And if they need assistance, we're there to help them. The next one we're going to get into a little bit here is a fire. So what if a fire happens? The first thing I want you to remember when it comes to a fire is the acronym RACE, R-A-S-E. So the R stands for rescue, where we're going to rescue individuals in danger, get the people that are closest to the fire, and move them away from the fire. We want to make sure that A is for alert. We are alerting everybody that there is a fire and there's danger and we need help. C is confine the fire by closing all doors and windows, okay? So what we want, what fuels a fire is oxygen. So by eliminating oxygen and containing the fire, we can prevent it from spreading. Most hospitals, nursing homes have doors that allow 2 hours before it can penetrate those doors into the other section. So it's important those are closed. Same thing with ceilings and floors, that it may take 2 or more hours to penetrate, just depending on how the building was made and everything. But it's really important we keep doors and windows closed, closing any doors and windows where the fire is not. All right. E is extinguish the fire with the nearest suitable fire extinguisher. Okay. So R is rescue, A alert, C confine, E extinguish. All right. So that's sort of the acronym we use to try to remember what we need to do when a fire is occurring. Make sure you're always following your facility policies. All right. Next one is fire preparedness. So it's really important. We're just sort of building off this. Is we want to make sure we quickly assess the situation. That way we can get those people and rescue them, right? Get them out of the area. So stop and quickly assess the situation. Make sure we're yelling for help or pulling the fire alarm or calling the fire code if that's the policy of where you work. We want to once again remove all residents from the area. Our number one job is to keep our patients, our residents safe. We do not want to open windows, just to be clear. We want to close all the doors to the rooms as well. We want to evacuate residents and rooms on both sides of the affected room. So for example, say what we do is we hear the alarm go off for a fire. What we're going to do, say we're in a hospital or a nursing home, we're going to start at one end of the hallway and we're going to walk in the room. All right. If you do not see the fire, you're going to do a good inspection. You're looking through at the trash cans, electrical outlets, the patients, the bathroom. There's no fire. You're then going to shut the windows and the doors and go to the next room. You do not take the patients out. At this point, it's important to keep them where they're at. You'll go to the next room, continue going, closing and shutting those windows and doors if the fire is not in there. Now, if we find a fire in a room, what we need to do is immediately get the residents out of the room that the fire has occurred in. And then on each side, so the room on each side of the room where the fire is, we need to get those residents out of the room as well. The rest of the residents or patients will stay in their room. All right, so that's important to note. We are going to move the residents, once again, that are immediate risk to the end of the wing, farthest from the fire, or to a wing or a unit that's entirely different. Once again, follow the policies and procedures of where you work, okay? We're not evacuating everybody. It is very, very rare in the healthcare field to see a full evacuation of a hospital, nursing home, assisted living, or anything of that nature. What we have to do is we're going to contain the fire, and we're going to move those people that are immediate risk out of the way, all right? To continue going off fire preparedness, I want to talk about how to fight a fire with an extinguisher. If it's small, we can use an extinguisher. If it is a large fire, an extinguisher is not going to help us. So only if it's small and contained do we use the extinguisher. Now, I did just say that evacuation is rare, and that is still very true. However, there are going to be extreme circumstances or times that we have to evacuate individuals, patients, residents from a hospital, nursing home, assisted living, foster care home, wherever it may be. And so this is how we're going to do it. There's sort of a standard on how this works. The ones that are nearest to the fire need to get out first. Ambulatory residents or patients. These are people that can get up, walk, and move on their own. We need to get them up and start moving them towards the door. From there, you are then going to go those residents who need assistance. So patients and residents who need assistance. They can't get up on their own. They can't walk on their own. Those people are going to be next with those with wheelchairs as well. Then from there, we are going to go and get the most severe, complicated patients. Those individuals that maybe they need lifts to get up. Maybe they can't get out of bed. They're on bed rest. They're bed bound. They can't get up and move. All right. This does not mean that one patient is better than the other. So a lot of people struggle with this when we talk about it. So I want to be really clear about that. It does not mean that one patient is better than the other. Just because somebody can get up and move, they're not as sick, doesn't mean they're better than the next and their life is more important to the next. What's important here is that we save as many people as we possibly can. So the more people we can get out, the more lives we can save. The individuals that can move on their own can start moving. That's multiple people we can get out the door that are not affected by the fire. The people who need assistance take longer to get up and get moving. So that's why we do it in this order. Once we've gotten all the patients out, if there's time to safely get the charts and all the charts, then we can. However, nowadays everything is on the computer. So that's not something that we're worried about as much anymore. However, if your facility does, that would be it. But once again, that is only if it's safe. Do not go back in and risk your life for charts. When the alarm sounds, once again, we've already sort of gone over this, but when the fire alarm sounds, make sure you're clearing residents out of the halls, into their rooms, and close the door. Nobody should be in the hall unless there's a fire in the room. And once again, if the fire is in a room, we're clearing out that room and the room on each side of it and taking them far away from the fire. We're not leaving them just in the hallway. Anybody that is in the hallway, we need to move to their room as long as the fire is not there or in the area, okay? If there are several residents or patients in a gathering area, make sure we close the doors to that room unless the fire is in the immediate area, okay? And we want to make sure that the halls are free of any obstructions. When a fire starts, there tends to be a lot of smoke, especially if we cannot contain it. What we don't want is all these things in the hallway, because when the firefighters come in, they use the wall as their guiding. All right, so they're guiding their way through the hallway. And if we have things against the wall or in the hallway, it can cause them to trip and fall and become injured, burned, different things of that nature. So we want to make sure we move everything that's in the hallway away from, make sure it's just free of obstructions. And then once again, wait for further instructions from a supervisor. Most facilities have each job duty. So all the CNAs are going to do this. All the nurses are going to do this. All the supervisors are going to do this. All the maintenance people are going to do this. All the dietary, kitchen staff, all the housekeepers, every job, all right, unit has its own duty, its own thing to do in each emergency. So make sure, once again, you follow the facility and policies and procedures. Remember, above all, our patients and our residents are the people that we need to look out for the first and foremost. Next. So assisting the resident who is burned or a patient who is burned, okay? So you'll hear me use, just an FYI, resident, patient, interchangeably. It all means the same thing. You'll even hear clients when it comes to home health care. So it's all the same thing. So somebody who is burned, all right, they've burnt themselves. Make sure you remove the source of heat. Do they have a curling iron on them? Did hot water, whatever it may be, we want to make sure to remove that source of heat. If they had hot coffee spill on them or something of that nature, we want to get those clothes off of them before it continues burning their skin. We want to make sure we call for assistance. We wash our hands. When possible, report the degree of the burn. That's something that you're really not going to be trained to do in this class. So if it's something you get further training on, you can. We want to make sure we cool the area with cool water until the pain subsides, okay? Burns, if anybody here's had burn, if you even just cooking and you burn your finger on the stove or a pot or a pan or anything of that nature, think about you burned your tongue because the food you ate was too hot. Burns are painful, so just be aware of that, but we definitely want to cool the area with cool water. We want to assist when necessary. Make sure the resident is comfortable and safe when we leave, and wash our hands. And then anything abnormal, obviously we need to let them know, and an incident report would have to take place. A lot of common causes for burns are unsupervised smoking, contact with hot objects and liquids. What we see a lot in the hospital and nursing home setting, spilling things like hot tea, coffee, things of that nature on them. Bath water can be too hot, so you're giving a shower, a bath, something of that nature, you're helping wash their hands, that water can be too hot. That's important that you make sure of the temperature. We're always checking things. Hot packs and heating pads. This is huge, all right? A lot of people tend to burn themselves this way, so making sure we're aware and those are not being used unsupervised. Once again, food, beverages, spills, or by ingesting. So like I said, drinking something that's too hot, eating something that's too hot can burn the mouth. A metal near a heat source, all right? That, and then not realizing it and touching it can be a huge problem. That's where a lot of people can burn themselves as well. Chemical burns are another huge thing, and this isn't just for patients. This is with a lot of employees. Like we talked about those hazardous substance and that safety PowerPoint. That's important to be aware of, and electrical hazards as well. Frayed power cords, electrical cords, extension cords, things of that nature. So electrical safety, make sure, like we talked about this a little bit, but just going back over it, when you're using electrical equipment, avoid damaged power cords, any extension cords, any electrical equipment while collecting blood, and try to use those 3-prong plugs when possible. Now, what if somebody's having a seizure? When somebody is having a seizure, it's really important you call for help, all right? Get more people in there to help you. Do not leave the patient. Make sure you help them lie down. We're never going to hold them down. We're never going to restrain them by any means. If possible, they can lie on their side. That way, if they're vomiting, if they have excess saliva or anything of that nature, they're not vomiting or aspirating, meaning it goes into the lungs. We want to make sure, once again, we do not restrain. I can't tell you that enough. Any objects that are in the area, we want to make sure we move away from them. We want to make sure that, if possible, if there's a pillow we can place under their head, that we put it under their head. That way they're not hitting their head as they're seizing on hard ground. We don't want to cause any more damage. If there's, we can loosen clothing around the neck if possible, but if it's too difficult, don't do that. Like I said, place the pillow under the head for soft padding. And once again, that's going to protect the patient's head. If you think of the hospital, if it's out in public in a parking lot, you don't want their head hitting repeatedly cement, hard tile floor. So placing a pillow, anything that's soft around their underneath their head would be very helpful. It's really important to observe the patient during the seizure and following the seizure. How long did it last? What did it look like? These are a lot of questions the doctors may ask. Make sure the resident's safe and comfortable when you leave, and that assistance has been the nurses, doctors, whoever's there to help. All right, what if we have an unconscious resident? All right, our patient. What's important here, once again, we're always going to call for assistance from the nurse, the nurse or the doctor. We want to check for a pulse. We want to check for breathing. You can check for a pulse. The most common area is the carotid artery. That's the artery in the neck. So if you feel down the middle of your neck, you're going to feel your trachea. Just to the right of the trachea or the left, there's a little like divot in our neck, sort of. You can feel your carotid pulse there. So you can try to feel on your own, but that's where you would check for an adult and a child. You're going to check for breathing. Is their chest rising and falling? All right. Lastly, if possible, if you are trained and per your facility policy, you would begin CPR. If you're not able to do so, you can inform the nurse of if you found a pulse or breathing when they came in, and they will probably check again. If you see anything else going on, make sure you report those to the nurse and assist the nurse or anybody else there to assist in any way possible. The next emergency situation we're going to talk about is severe weather. So, for example, a tornado. It's important that we move all the patients into the hallway when a tornado warning takes place, that all the blinds should be placed down and closed on all the windows. Doors should be closed as well. We want to just keep away patients into the hallway, away from any windows, anything of that nature. That way, if tornado does come through, most times windows get broken, tree branches and different things will come in through the windows, and we don't want our patients by those windows so they are not hurt. So doing the best we can to get them all in the hallway. Once again, follow the policies and procedures of where you work though. Shock. So what are some common signs of shock? So this is when somebody goes into shock due to a medical emergency usually. All right, so they're going to be clammy, pale. Their skin's going to be cold, all right? They'll have a rapid, weak pulse, meaning that their pulse is going to be going really fast, but it may be difficult to feel because it's weak. Their breathing could be shallow, so hard to see. So hard to see that chest rise and fall when they're breathing, and breathing more frequently. So in and out, almost like a hyperventilation, but harder to see. All right, their eyes might be like sort of staring, sort of looking out like they're zoned out, and expressionless face. Those are some of the common signs and symptoms. So it's important when somebody does go into shock that we maintain an open airway. So does that mean we have to tilt the head back a little? We need to call for assistance immediately. Make sure we keep the patient lying down with a head lower than the rest of the body. A lot of times in shock, we'll see the blood pressure drop, and that's a way to get it to increase. We're going to attempt to control bleeding or any other cause of shock if known. So if they're in shock because they've lost blood or different things of that nature, we want to make sure we're trying to control that bleeding, all right? Try to keep the patient warm and awake until help arrives. Those are important things. So those are a lot of the emergency situations that we're going to see take place in the healthcare field. So it's important that we are aware how to handle those. And like I said, make sure that you are following the policy and procedures of where you work.